valid question when patients who are elderly, or patients who have arthritis in their knees, or patients who had a previous stroke, for example, and if they have chest pains and they can run on a treadmill, do we have an alternative test? Well, if we can't do a stress test, then yes, there are alternatives to the stress test where we can assess the heart using a chemical stress test, for example, meaning we can stress the heart out not by exercise, but by injection of a chemical to stress the heart out. This is done, for example, one of the tests that we can do here is the dobutamine stress echocardiogram. That is a stress test using a dobutamine injection. Dobutamine is an intravenous injection done to cause the heart to pump faster and harder. Basically, it's a chemical induction of stress on the heart. And that gives, and while the dobutamine is being infused, you can monitor the heart tracing. Pretty much like the stress test, you can also monitor the heart's performance using an echocardiogram, ultrasound of the heart. Scan of the heart, an imaging modality, for example, an MSCT or cardiac scan, which is a CT angiogram where we inject dye, which gives us a roadmap of how the heart behaves. This will give us further information as to how many blockages you have and how severe those blockages are. You can also do a calcium score. And ultimately, if you have failed the stress test, then we would do an angiogram for you. How accurate is a stress test? Whilst a stress test is actually a useful test in allowing us to see if there's any strain on the heart when you exercise, there are limitations to the stress test. The stress test, in terms of accuracy, if you look at the literature across the board, it's only about 70 to 80% in accuracy in terms of picking up blockages. So there is such a thing as false positive and false negatives with stress tests. But there are some people, as I alluded to earlier, for example, young women who run on the treadmill and they have some abnormalities in the heart tracing. So by definition, they have failed the stress test. It's a positive stress test. But subsequently, if you were to do a heart scan on them, you find that their arteries are actually pristine, clear, no blockages whatsoever. So the stress test is not, unfortunately, not a scan. So it's not 100% accurate. Okay, so that's one thing that we have to be clear about. Notoriously inaccurate in young women, and that is one of the reasons why I do not advocate doing a stress test in healthy young individuals without any risk factors. So I think it's best to see a doctor first before deciding whether you should go for a stress test. Another common question that I often get asked by my patients are, if I've done a stress test, do I need to do an echocardiogram? And the echocardiogram, on the other hand, is an ultrasound scan of the heart, and it gives us a lot of useful information about how the cardiac structures appear. They give information about the heart valves, gives us information about LV function, which is the main pump of the heart, whether it's pumping well or whether it's enlarged or whether it's weak. It gives us information about blood flow across the heart chambers. So it's different. It doesn't tell us directly whether there are any blockage issues compared to a stress test, which is done to assess the function of the heart when the heart is being stressed out. So two different modalities, but the information from both tests are often complementary and it does help. For example, when somebody has a heart attack, somebody has angina, we may want to know how they perform with the stress test, but at the same time, we want to do an ultrasound or the echo to see if there's any scar tissue from the heart attack, whether there's any damage done to the heart muscle. So the information from both tests can be very useful and complementary in many cases. Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share, and comment. Thank you.